We're going to focus with some light touch and light movement techniques on the head, the poll, and the neck. A little bit of anatomy first. We have the head. Everybody knows that one. And then the first vertebra of the neck is the atlas, and this would be the junction between the poll and the head and the atlas. And then we're going to work down the neck. We have the vertebra of the neck running down here, and then we have the nuchal ligament and other muscles of the neck up here. The principle with the light touch is the same as with the bladder meridian, but we're focusing in on specific areas. The poll accumulates tension, as I said, from a lot of different things. Anything going on in the body, a sore back, hind end, sacroiliac, sore muscles behind, sore front feet, ulcers, anything going on in the horse creates tension in the poll. As we go over the rest of the horse and we start finding things, we can start to relate them to what we're finding in the poll. Generally, if a horse has sore front feet, he's going to be reactive in this area here, or there's going to be tension in here. Often I have found, in my experience, the top of the poll here will go with a sore back, which makes sense because we have the nuchal ligament, the top line, running along the top of the horse to the back. If the back is sore, the horse is going to want to raise his head and get away from the pain to invert in the back, and that'll create tension here at the attachment at the poll. Dental issues will create tension in the poll. You'll get tension in the TMJ here. I want to point out one more thing. The atlas, the first vertebra of the neck, and the sacrum, they go together on the horse. When there's something going on in the sacrum, there'll be something going on here. When you're working on the poll in the atlas, as he releases tension in the atlas, you'll often see the horse wobble behind from leg to leg because he's feeling the release in the sacrum too. So when we look at the horse, the responses as we're working on the horse, we're looking at the whole horse. We're not just looking at the face. We're paying attention to what's going on behind too. I'm going to talk about the areas we're going to go over. The forehead and the face, the top of the poll, the jawline groove in front of the atlas here. There's a groove between the jaw and the neck, and the TMJ point right here, and the crest and the top line of the horse. So we're going to start with the face. Why do we do the face? You may have noticed on a lot of horses that the face is, the forehead's very hard. It'll be like a rock. I associate this with mental tension in a human, and the mental tension can come from mental factors such as worry, or it can come from pain. Pain causes worry in the horse. Over time, they'll get very tight in the forehead. You can search for these, for responses in the forehead by using the palm of your hand and just rest it gently on the forehead. Stay here, buddy. And just using barely, as if you were just moving paper. I'm going to put my hand there. He's already relaxing a little bit. And I'm going to gently move the skin upwards towards his poll, just gently, without pushing. You have to do it as if it was an egg yolk. If it were an egg yolk, you wouldn't push it or you'd make a mess. So I'm going to just gently shift the skin and watch for a response. His eyes softened a little bit. He's blinking and his head's dropping. And hold and soften again. And maybe come down. You're searching for a directional movement of the skin on the forehead for a response. And when you get that, you'll hold. It's a very gentle, subtle technique. You're getting movement in the skull. There are plates on the skull, and the same as in humans, we get tension and it puts torque on the bones of the skull. So we're gently asking that to let go. So that's how we would do the forehead. We could also search for spots around these muscles on the forehead or up here by the front of the ears for responses. That's how we would use the forehead techniques. On the top of the poll, same thing. We're going to, as a practical matter, if you have these English halters, they're nice because you can unhook this and you have more room to work up here. You want to make sure you hook this on a ring here on the halter because he'll find something to hook it on if you don't, such as a water bucket or something, and then you won't have a relaxed horse. So we would search up here behind the poll and between the poll and the ear for responses. That's the area we would search on. Now the jawline groove, it'll start right up here behind the ear and go down here in front of the atlas. It ends down here. There are some muscles. There's often a hard muscle right here. that attaches, and there are muscles that attach to the base of the skull and the atlas and go down the neck and attach inside the forelimb and to the sternum. The brachiocephalic, the omotransverse, the omohyoid, and other muscles that aren't important to know the name of the muscle. What's important is the horse tells you there's something there, and you help him release it. So we would search down behind the jaw, right in here. We got a response. Very lightly. You can use a couple fingers, one finger. Use the flats of your fingertips. And down into here. Often this is where you'll get a response in a horse. Now, another reason a horse would have tension in here is because he's bracing against the bit. If you have a horse that's pulling or bracing, especially one side more than the other, you would put some attention on this area to help him release some of that tension. There we go. I'm going to reach around to the other side while I'm talking. That's only part of it, though. It's helpful if you determine what's causing the bracing and the pulling. It could just be training. He's just not been trained yet. But in the trained horse, if you can't train the horse out of a behavior, it's because something's creating the discomfort that's causing him to do that. And so if you can find the tension and discomfort that's causing that behavior, and you can, what's the cause of it? So in his case, and not in Primo's case, but say a horse is bracing and pulling. If he's pulling more on the right side than the left, then there could be something that's creating that tension on the right, such as a foot issue on the right. The foot on the front foot and this part of the atlas go together. It could be dental issues. You would want to have your horse's teeth checked. It could be a sore back if he's going inverted with his head in the air. It could be tension in the poll is caused by outside trauma, such as pulling back or going back, rearing up and hitting his head. More common is a lot of horses are trained not to pull back. They're trained to tie by hard tying them to something that won't break. And when the horse pulls back against it, it'll jam up the poll and the atlas and back here. And that'll stay there. Horses don't release tension on their own. They protect it, they just block it out, and they keep going. So you could have an old issue. If your horse had pulled back hard against a halter in training or in any situation in the past, or hit his head or gone over backwards, that'll be jammed up, and it'll stay that way. He'll only release so much of it till you bring his awareness to it and give him a chance to release it. So we're going to review the forehead, the top of the poll, the jawline groove. Now we're going to go to the TMJ. Right, the TMJ is the temporal mandibular joint. There's the temporal bone on the skull, this bump here over the eye, it's a bone. Then we have the mandible. There's a bump here, and the jaw goes down here. That's the mandible. And where they join here, in the middle is a little groove, is the TMJ, the temporal mandibular joint. We would look for blinks right in that, search in that groove for a blink. I'm going to do the other side too. And search for a blink. You can do both sides or one, but it's good to know which side has more tension until you get a blink, and you would wait there. Now, how long do you wait? It's the same as bladder meridian. It might be 5 seconds, it might be half a minute, or it might be a full minute. If nothing happens after you've gotten a response and you've waited a while, just move on. So we have the temporal TMJ, and then the last area is the crest, the nuchal ligament here. So the nuchal ligament is a big, flat, wide ligament that runs the full length of the horse. It starts at the poll and it ends at the sacrum in the tail. From this section to here is called the nuchal ligament. These muscles here are rhomboids. Often you have a lot of development of muscles here in dressage horses because they have to lift in the withers. And so we're going to search along here for blinks. Anywhere along the crest. Stay with me, buddy. Usually when he starts doing that, he's got something to release and he doesn't want to show it. So that's a fidget that he's telling me something's going on. And as you saw earlier with the bladder meridian, that was the precursor to releasing. So that's a fidget. So what I did with this hand is I softened out. Instead of being specific on a point, I made it easier for him by just covering a larger area. For some reason that helped. But you would search along here for blinks on the crest line, the top line. And those are the techniques for the soft touch techniques, light touch for the poll and jaw and neck. But now we're going to add another component to this. We're going to start to ask for movement. Movement in a relaxed state of a joint or junction releases tension in the connective tissue of that joint or junction. It releases tension in the muscles. So the muscles that are attaching to the bone, the skeleton. So what we're going to do is we're going to go back over some of these points. Come over here with us, buddy. Come on. It's not so bad. There we go. We're going to focus on, starting with the jawline groove, we're going to focus on asking for movement in here. Now the way we'll do that is we're going to use his nose to wiggle this junction. You put your hand on the nose. It's also always helpful to slip your thumb and finger over here so that if he throws his head, you don't have to grab him so much, because this hand has to stay very light. I'm going to rest it here very lightly, just air gap. I'm going to search in here, bring his nose slightly towards me, so there's a little relaxation in here. I'm going to search down in here for a blink, right there. Now I'm going to rest my finger here just using egg yolk and gently wiggle his nose side to side. So he's telling me that he could use some release of tension right here. So wiggle side to side and then soften. If he throws his head around, just that's a fidget. It means that he feels something. You'll just stay soft with him. That's why we do this. You don't ever grab the horse's nose or he'll brace and it won't work. And then we're going to wiggle again, gently, and soften. See, we found a spot here that he could use some release on. We're going to bring his nose toward me and we're going to do it again as soon as he stops fussing. He's just telling us that it's a little uncomfortable, so we let him work it out. This hand stays soft too. And when he stops fussing, we'll ask for another tiny, tiny wiggle. And we're going to search all the way down to the bottom here. And wiggle. Wait till he stops fussing and wiggle. No pressure. It's a relaxed movement, side to side. A wiggle is about as relaxed movement as you can get. It doesn't have to be a huge range of motion, the movement. It only has to be a tiny range of motion with a huge amount of relaxation. So the wiggle provides that. It's not a big movement, it's a gentle, relaxed movement. And we're focusing on the spot that he tells us he could use help releasing. So that's the jawline wiggle using a little lateral movement. Another technique that we can use to get movement is to continue down the crest line or down any part of the neck. The vertebrae run down here, but we're asking for wiggles as we go. We're going to find out where he says we can, right there. Soften, both hands, tiny wiggle. I did a very gentle wiggle, tiny, and then wait. Don't keep going. You want him to be relaxed. Wiggle, soften, wiggle, soften. Slide down. Don't get too over-focused on one spot. If you get too focused on one spot, the horse will start to get uncomfortable and he'll start to build up an internal brace against it. And we're also going to watch the hind end, because as he releases tension up here, we're going to just let him fuss around a little. If he pushes his head around, just ask him not to. Give a tiny wiggle here. Actually, I don't need to wiggle. All I have to do is bring his head towards me a little and rest here. And now I'll wiggle. Let him let that out. Now we'll slide down here. Search. We're going to give that a rest. It works much better if you go back and forth over an area rather than get too focused on it. Because as I said, the horse has been hiding that, or he doesn't even know it's there because he's been blocking it out. And wiggle and soften, and we continue all the way down. Let me give him a rest, step back and see what he has to say. We'd continue all the way down to the withers with that. The crest line wiggle. Stay with me, bud. Now, as we know, when he does that, he wants to release something, but he doesn't want us to see it. So we just give him some space. Give him a chance to work it out. Right, buddy? And there is one more technique to get movement in the TMJ and the pole. Are you ready, bud? So did you notice he relaxed the right hind just now as he did that? That releasing tension in the pole, you're going to start to notice a lot more movement and relaxation in the hind. Okay. Now we're going to get movement in the TMJ and in the pole. We're going to do that by resting our thumb on the roof of his mouth gently, and he's going to move his tongue in and out. The tongue is a long muscle. It attaches up here between the jaw bones, between the mandible, to a bone apparatus, a very delicate apparatus called the hyoid apparatus. It's bones up here between the jaw, and they're floating loose bones, and they're very delicate, so you don't want to push really hard on the roof of his mouth. We're going to rest our thumb very lightly, and he's going to move his tongue in and out. and it's going to start releasing tension in the pole. I refer to it as massaging the pole from the inside. And it's also going to get movement in the TMJ here. And I'm going to show you how to do it now. So you take your hand, and I'm going to rest it on his nose here, gently. And right here where there's no teeth in here, I'm going to stick my thumb in there and rest it on the roof of his mouth and let him move his tongue. And I'm going to move this back so we can see the TMJ a little more. And the other hand needs to be on the halter, not to fight him, but just to go with him. I'm not going to pull on his head. I'm just going with him. And he's going to move his tongue in and out, and you're going to see more movement up in the TMJ. Stay with me, bud. It's okay. At first, it'll bother the horse, but after it starts releasing tension, he's going to feel better. He's going to stop fussing so much. So I'm not pushing hard. I'm just resting my thumb on the roof of his mouth. Often they'll start to yawn while you're doing this. The one thing to be careful of is not to let him grab your thumb with his tongue and drag it up into his molars. So that's the thumb on the roof of the mouth. That's to get the tongue and the TMJ and the pole moving. You can do this from both sides. You'll get a little different movement on each side. The key things to remember are don't push hard, don't grab, don't push hard on the roof of his mouth. Keep your other hand on the noseband here so you can go with him. Those are the two key things to remember with this technique. And then we'll step back and see what he has to say. Good boy.